One of the things that really bothers me about the way that fibromyalgia patients are treated is that many aren't treated, or at least are considerably undertreated. Sure, many of you are placed on an antidepressant medication or perhaps a painkiller or an anti-inflammatory. You might be sent to therapy of some kind. You might even be placed on one of the newer medications that are specifically approved for fibro. But what if this isn't enough? Or what if you have trouble tolerating the medication you've been given? What happens then? This leads me to two ways in which I believe many fibromyalgia patients are undertreated. The first relates to how doctors treat, or don't treat, or even diagnose other conditions you might have. And the second relates to specialists who refuse to even see you, claiming that there's nothing they can do since there's no cure for fibro. In this video, I want to look at the first of these two reasons. I used to tell my patients that the one good thing about having fibro is that you'll never die, because you can't possibly come down with anything else. There seems to be the perception among many doctors that once a patient has fibro, it explains every single ache, pain, or other symptom that patient has or ever will get. Doctor, my head feels like it's going to explode. Don't worry, it's just your fibro. Doc, I haven't been able to see it on my left eye for 3 days. No problem, it's just your fibro. Doc, my right leg fell off and is in a plastic bag in the trunk of my car. No sweat, it's just your fibro. But it's not your fibro. The fact is that having fibromyalgia doesn't make you less likely to have other conditions. It makes you more likely to have them. For example, there's a clear association between fibro and low thyroid levels. If you happen to have fibro and be hypothyroid, well, thyroid replacement medication might help you with your fatigue, your sleeplessness, any depression you might have, and possibly even your pain and other symptoms. There also is a real association between fibro and a variety of arthritic conditions like rheumatoid arthritis and lupus, and these usually warrant treatment that is different than what you'll be given for fibro. Fibromyalgia also does not protect you against a variety of localized pain conditions like shoulder or elbow tendonitis or bursitis of the hip, conditions that are quite treatable. Let me give you a couple of examples of former patients of mine who did very well once another condition besides their fibro was diagnosed and treated. I once had a patient who was an elderly man who had had fibro for years but was doing quite well. He attributed this to exercise, which included walking at least 5 miles every day. But then he started to have increased pain, and his walks got shorter and shorter, until finally they stopped altogether. By now he was in a lot of pain everywhere. When I questioned him about how this all had started, I found out that the first part of him to really hurt was his right foot, and it was the main reason his walks had gotten shorter. What I found on exam was that he had a condition called plantar fasciitis, which means inflammation of a large tendon under the foot that attaches onto the heel. I put him on an anti-inflammatory medication. I referred him to occupational therapy for ultrasound treatment, and I also sent him to an orthotist for specialized insoles for both feet. Guess what? His right foot pain improved dramatically within a few weeks, and within a few months he was walking everywhere again and feeling great. Now, what would have happened had I just told him it was all just his fibro? I'm sorry, but it's true. Some doctors consider their fibro patients to be a real headache. Well, I remember once meeting a fibro patient who really was, or at least headaches were by far her biggest problem. She suffered from migraines that were severe and she'd been seen by several specialists. But everyone just attributed her headaches to being part of her fibro. Well, I'm sorry, but there are numerous highly effective treatments for migraines, and I agreed to try various migraine treatments until we found one that really helped this woman. It didn't take long. Within 3 months, her migraine headaches that she used to wake up with every morning and often go to bed with every night were 90% gone. This meant she was sleeping better, her anxiety level was way down, her activity level was way up, and guess what? Her overall pain and fatigue, aka her fibro, was much better too. My main point is this. Just because you have fibromyalgia doesn't mean that you can't get other conditions that might be very easily treated. A big problem is that your fibro symptoms may mask some of these other symptoms. Consequently, doctors should be more vigilant and not less vigilant, looking for other things when you come to them with a new symptom or dramatic worsening of a symptom you already had. This doesn't mean the doctor needs to get a CAT scan and brain biopsy every time you sneeze, but it does mean that he listens to you and does an appropriate examination and, if necessary, other workup. Please go to www.thefibrofog.com to see what I'm doing to change public and professional opinions about fibro and raise money for fibromyalgia research. Together, we can make a difference.